Hello everyone, I am Dr. Anita, consultant microbiologist. I am here to discuss about cardiovascular infections, that is infective endocarditis and acute rheumatic fever. So coming to the chapter preview, it includes the introduction about the cardiovascular infections, and next session would be on infective endocarditis, that is classification of endocarditis and pathogenesis and clinical manifestations of endocarditis, and what is modified Duke's criteria, and rheumatic fever, what is rheumatic fever and pathogenesis and Jones criteria, and other infections of the heart and blood vessels. So today we will be covering all these things. So moving on to the introduction. So includes infections. What is cardiovascular infection? It includes infections of the heart and blood vessels. So infections of the heart, that is infection of the three layers of heart wall, that is endocardium, myocardium and pericardium. Endocardium, which is the innermost layer of the heart that lines the cavities and walls of the heart. Infection of the endocardium is known as infective endocarditis. Whereas myocardium is the middle layer of the heart that is composed of cardiac muscle and involuntary striated muscle. And this is responsible for contractions of the heart, and the infection of the myocardium is known as myocarditis. The innermost layer is endocardium and middle layer is myocardium. And pericardium, which is the outermost layer of the heart, that is composed of connective tissue and fat. This connective tissue secretes a small amount of lubricating fluid into the pericardial cavity. And infection of pericardium is known as pericarditis. And collection of excess fluid in pericardial cavity can cause pericardial effusion. Collection of excess fluid in that cavity, that space, can cause pericardial effusion. And infection of blood vessels, this includes mycotic aneurysm and infective endarteritis. And next is device related infection, that includes catheter related bloodstream infection and suppurative thrombophlebitis. And finally autoimmune mediated, which is acute rheumatic fever. So this is a picture showing layers of the heart, that is pericardium, which is the outer layer of the heart, and this is myocardium, the muscle layer, that middle layer, and endocardium, which is the inner layer, inner endothelial lining covering the trabeculae. And this is the visceral layer, that is epicardium. Okay, this is a space which contains the fluid. And coming to the infective endocarditis. So what is infective endocarditis? It refers to microbial invasion of the heart valves or mural endocardium. So that and it results in formation of bulky friable vegetations composed of platelets, fibrin, microcolonies of organisms, bacteria, and scanty inflammatory cells. So that is microbial invasion of heart valves and mural endocardium, that is infective endocarditis, resulting in the formation of vegetation. Which type of vegetation? That is bulky friable vegetation. What it is made up of? That is composed of mass of platelets, fibrin, bacteria, that microcolonies of bacteria, and scanty inflammatory cells. And vegetations are most commonly present on the heart valves, followed by low pressure side of a ventricular septal defect, and on the mural endocardium. Mainly the vegetations are found on the heart valves. So this is a picture showing vegetation in infective endocarditis. These are the vegetations which is composed of mass of platelets, fibrin, and bacterial colonies, that is microcolonies of organism, and inflammatory cells. Large irregular masses on the chordae that extend onto chordae. So coming to the classification, so based on rapidity of evolution and severity of infection and virulence of organism, it is classified as acute and subacute. Acute endocarditis is frequently caused by high virulent organisms like Staphylococcus aureus and attacking a previously normal valve. And it rapidly damages the cardiac structures and spread to the extracardiac site, and it is capable of causing substantial morbidity and mortality even with appropriate antibiotic therapy and surgery. So acute endocarditis is caused by high virulent organisms like Staph aureus. So most common organism causing acute endocarditis is Staphylococcus aureus, and it usually attacks a previously normal valve. And it initially damages the cardiac structures which progresses and spreads to extracardiac site. And subacute endocarditis, it usually occurs in a previously damaged valve. That is a major difference between acute endocarditis and subacute endocarditis. Here it is caused by a low virulent organism, example viridant streptococci. And it is insidious onset and it is slowly metastasized and is gradually progressive over weeks to months. So usually most patients recover after appropriate therapy, unlike acute endocarditis. So this is a table showing difference between acute and subacute endocarditis. Here, as I said, as evolution is rapid in acute endocarditis, here it is slow. It involves normal cardiac valve in acute endocarditis, and in subacute endocarditis it involves previously damaged heart valves like scarred valves or deformed valves. And here acute endocarditis is usually caused by a high virulent organism, and the most common organism is like Staphylococcus aureus, whereas subacute endocarditis is mostly caused by low virulent organisms like viridant streptococci. And acute endocarditis, it causes substantial mortality and morbidity even with appropriate therapy and surgery, whereas here there is a gradual progressive course and usually patients recovers with appropriate antibiotic therapy. And acute endocarditis is less common, it's only 10 to 20%, whereas subacute endocarditis is more common, that is 50 to 60%.